So, Ellen, hello, how are you?
Hi, fine, very good today.
So, we are continuing this series of webcasts about Geneva solutions. Would you quickly introduce yourself and tell us what you're doing with us?
Well, I'm the editor of the Health Stream. I was a journalist for about 25 years, working including in the Middle East and the United States. And then I worked for WHO actually for about 15 years, mostly in public health and environment, also in tropical diseases. And now I'm the editor of Health Policy Watch, which is a dedicated nonprofit health news service. And we're collaborating with Geneva Solutions to produce a health stream that will appeal to the broader Geneva public and hopefully the world.
Okay. Um, what do you think are the main issues in your field, like global health, for Geneva solutions?
Well, obviously, this year we've seen COVID, the pandemic, become the overriding story. It's moved health actually out of a niche subject that was the business of health reporters and ministers of health to something that presidents and prime ministers are deeply concerned about. It's affecting U.S.-China relations. It's affecting the U.S. elections, and it's affecting almost every aspect of geopolitical movement today. So what we're dealing with is a huge beast. But I think this also brings to light a lot of long-standing problems in global health. We're seeing health systems that spend a lot of money on health, and are supposed to be well-funded, performing very poorly on COVID. So we've seen a lot of ways in which health systems work or do not work, what works, what doesn't. And we've also seen that people with pre-existing conditions like heart disease, high blood pressure, cancer are much more vulnerable to COVID, as are people in cities with lots of air pollution. So I think this is bringing together a lot of longstanding health issues, which we were always trying to talk about. And now the public is very keenly aware of these. Plus, we're seeing the synergy between environment and health, which is huge. In other words, this disease probably emerged from a wild animal that was illegally consumed in
Yeah.
Asia. And this is part of a much bigger problem we have with our sort of meat-hungry world, which is really destroying our biosphere as a result of our consumption patterns. So, and this also creates disease. So all these things we want to bring together in our coverage of Geneva Solutions.
The, the,
Of
the
the health.
motto the motto we have is like what happens, what works. So, what do you think is working in this whole landscape that you just described?
Well, actually, despite all the criticism levied at WHO, at the World Health Organization, which is housed in Geneva, I think it's actually performing, it has performed many aspects of its role very well. I mean, Tedros, the Director General of the WHO, has constantly called for solidarity. The WHO is bringing together a global vaccine facility where it hopes to be able to make vaccines available to developing countries and low and middle income countries at terms that are similar to those in high income countries, because we really need to get this vaccine to the high risk people around the world. So I think there are many things that are going well. We're in a way lucky to have Gavi, the Vaccine Alliance, which is going to act as a broker for getting the vaccine distributed. And at the same time, this is, we see some systemic issues emerging. WHO is chronically underfunded. I can tell you from having worked on the inside, I would often feel like we had this tiny team that was projecting huge messages. I was working in the environmental health team about all sorts of the world's most critical issues. So I think we need to be looking at the funding of WHO, and also we need to be looking in terms of solutions at how WHO can stand up to countries when countries defy its prescriptions. WHO really was quite powerless in the face of China's decisions about how it would manage the vaccine crisis. WHO cannot really criticize countries, and that leaves it a bit paralyzed in a way that we may want to examine for future issues.
Okay. Coming back to the next days, I mean, what are you going to do this week? Do you have any program? What are your topics?
Well, we have an interview with Tal Zaks, the chief scientist of Moderna, which is one of the leading is producing one of the leading vaccine candidates right now. It's one of the 6 vaccines that are in what they call phase 3 trials to see if it really can work at large scale and be safe. And he's going to explain to us why their vaccine, which is called an mRNA vaccine, is different and how it works differently from other more traditional vaccines. So this will be the main emphasis of that interview. We also have another interview with the co-director of the Graduate Institute, Geneva's Graduate Institute Global Health Center, Vin Kim Nguyen. And he actually has a double role. He worked as a frontline medical worker, as a doc. He's an emergency room doctor by training and family physician. So he worked in Montreal during the height of the pandemic and really witnessed firsthand the crises in the elder care homes and what was happening to older people, and has some really interesting lessons learned from that experience that he'll tell us about.
Okay, so somehow Geneva is really at the center of this coverage. I mean, it's not absurd to cover global health from Geneva, right?
Well, Geneva is considered actually as the global health hub of the world. We have more global health institutions concentrated here per square kilometer of city space than anywhere else in the world. We have not only the World Health Organization with, I think, about 2,000 employees here. We also have Gavi, the Vaccine Alliance, and the Global Fund to fight malaria, tuberculosis, and TB, which are 2 of the institutions that were really founded about 2 decades ago out of the Bill Gates, Bill and Melinda Gates Foundation funding, and have been active in combating the traditional diseases that global health dealt with in the world, vaccine preventable diseases, and the traditional communicable diseases. And now they're being brought into the battle against COVID as well. Along with that, we have just dozens of NGOs. Every major nonprofit, health nonprofit, is based here. And we have operations of UNICEF. UNICEF is based in New York, but they've got operations here. So Médecins Sans Frontières has a big office here, even though I don't think they're based here. So we've got a huge amount of activity. And at the same time, I think the challenge is to be bringing in voices from other regions. I mean, global health has been accused, including very recently, of operating on a kind of colonialist or post-colonialist model. And one thing that I'm really personally committed to is trying to bring reporters from other regions to report on issues going on in global health so we can get some of those other voices into the conversation.
Okay. At the same time, I mean, there is this anti-vax movement that is kind of growing its influence. You have the anti-mask demonstrations in Switzerland, in London, in France this weekend. I mean, how do you see this? I mean, as a mission, people who should be convinced of vaccination, because after all, it has eradicated many diseases. People here in Switzerland do not believe in vaccination anymore, and kind of threaten the development of campaigns that will be probably brought by the WHO to poor countries. I mean, how do you see this challenge of convincing reasonable people, because after all they were brought in our education system, and still they don't believe anymore in vaccination, for example?
Well, I guess I have to say, speaking as coming from the United States, for me, what I'm very struck with in Switzerland and in Europe generally is still there is a much higher degree of social solidarity in our society than we see in some parts of the world, notably in the United States, where you might have anti-masker come into a grocery store with a gun. I don't think I've seen that in Switzerland yet. And having gone shopping at Migros, I mean, yes, some of the stores around here, most people are wearing masks. So I think that there's a high degree of social solidarity in Swiss society that actually is something we can learn from and model. And I think that social solidarity comes from the fact that we're only as strong as our weakest link, as WHO has said, that we really need to, we will need to vaccinate as many people as possible in order to make sure that our elderly and our poor and people that are vulnerable, pregnant women, don't become ill with COVID and have dangerous side effects. I believe that in Europe, most people will probably get vaccinated, and it'll be enough percentage to make a critical difference. But it's true that worldwide, this is a big problem. And I think the message again is, how can we convince people that they're only going to be as strong as their neighbor, that what they do benefits their neighbor, and what their neighbor does benefits them. And the mask is a great symbol of this, because actually my mask protects you from infection, and your mask protects me. My mask doesn't protect me as much as it protects you. Yeah. So really, you need a kind of universal agreement on this to make it work well.
Okay. Thank you very much. I'm looking forward to read your weekly newsletter in Geneva Solutions, and we are very happy about this cooperation. I think launching Geneva Solutions without a strong global health kind of competence wouldn't make sense. So I'm really glad and to see what we'll do together.
And we'll be happy to see how we can make this work for the wider Geneva Solutions community.
Yeah. Have a good day. All the best.
You too. Thank you.
Bye-bye.
Bye.